The Pumwani Maternity Hospital continues to be out of bounds for any new patient admissions. The facility that on any normal day would serve hundreds of women remained closed as the 41 nurses who tested positive for COVID-19 spent their time in isolation. And as Makori Ongechi reports, the Nurses Union has opposed the move by the hospital administration to ask for individual contributions in support of the isolated healthcare workers.
At the main entrance of Pumwani Maternity Hospital, the sign was all clear. A totally different picture of the facility that on normal days experiences an influx of patients seeking medication and particularly expectant women. This coming 2 days after 41 healthcare workers at the hospital tested positive for COVID-19. Now the writing is on the wall. No visitors allowed here, except maybe for those coming in to visit their kins admitted already, or perhaps picking those who have been discharged. The security officers are keen to note every detail of those coming in. They check through the list to determine who will access to the wards as they try to scale down operations. Only one person from visiting relatives is given permission to pick their kin. This as the 41 nurses continue to remain in isolation, where a majority are said to be going through the home-based care. Others are isolated at the Kenyatta National Hospital. But even so, there is a new concern. The hospital administration has now written to the staff at the facility asking for contributions towards helping the nurses in isolation. In this memo signed by the facility's administrator Nelly Nduli, all members of staff have been asked to offer their various contributions. The memo reads in part, I quote, "We kindly request for your support in cash and kind towards our fellow colleagues who have been tested positive of COVID-19. Kindly send in your support through your unit in charge." The memo rattling officials of the Nurses Union. The Kenya National Union of Nurses chairperson in Nairobi, Boaz Ochari, has questioned the move. He says, and I quote, "It is shocking that they are telling us to contribute for our colleagues in isolation, yet there is a kitty for health workers' welfare who actually fall victim in the line of duty." The hospital began conducting fumigation Thursday afternoon, 2 days since the cases were reported. Makori Ongechi, Citizen TV, Nairobi.